Hi, I'm back. I'm going to talk about the digestive system now. I'm going to start with the head and the anatomy and structures of the digestive system, starting from the mouth and then going on the other side. Okay, first we're going to start with the mouth, and this is where the beginning signs of mechanical digestion occurs. Inside the mouth you'll have different salivary glands. The one that's located under the tongue would be known as the sublingual gland. So it would be right under the tongue. And then under that, behind the jaw or the mandible, would be the sublingual gland. And then on the sides would be the parotid glands. Okay, after you're done chewing, what happens next? You swallow it. So when you're swallowing it, it passes the pharynx and it goes into the esophagus, which is a softer tissue than the trachea, obviously, because it contracts and it brings the food down. So it travels a pretty good distance, and then it goes to the stomach, which is located right here, and this stomach is actually very full. So it looks like the cat got a good meal before he passed. In the stomach, you'll see the lesser curvature and then the greater curvature. And at the bottom would be where the small intestine starts. So right here would be the pyloric sphincter, which separates the small intestine from the stomach and closes. And what happens is the stomach, it'll take about 4 hours to digest. It just wishes and washes around, breaks the food up, and there's actually muscles that are curved at different sides and move different ways, which move the stomach. And when that's ready, after it's churned, it will pass in through the pyloric sphincter a little bit at a time, and this is where the digestion process really occurs. Many times people who have acid reflux and all sorts of stomach problems, this is because these sphincters located within the stomach, which starts the small intestine or even the esophagus, they have these issues because the gastric juices, which have a pH about 2, slide through these sphincters, which causes mass irritation. Many times people have very bad heartburn, and they'll have to take different kinds of medications to soothe that pain. Zooming in, we have the liver. It does many different things. It shelters the gallbladder, which is located, where is it located? There it is. There's the gallbladder. Gallbladder produces bile, which aids in digestion, and it will squirt little bits at a time within the small intestine, located right here. Located in there would be where the hepatic duct is. Hepat meaning liver, duct as in the gallbladder exit, I should say, occurs. I'm lucky I was able to find this, but here's the pancreas, located right next to the small intestine. Usually it's pretty difficult to find in the cat, but it's right here. Located over here, we have the spleen, which houses fresh blood. And then going downwards, large intestine, duodenum. Then in the middle, usually in humans, it would be the jejunum. And then going downwards, we have the large intestine. Okay, right here we have the ileum, which is the ending of the small intestine. And then going into the large intestine would be the cecum. Here's the large intestine. Has some food in there. In the human, the large intestine would be set up as an ascending, transverse, and then descending. And the large intestine aids in large water absorption and then located at the bottom would be the anal sphincter, is a muscle which aids in contraction of the anus. The large intestine is also known as the colon, and the colon is known for storage of stool. On the wall of the stomach, in the abdominal area, we have the parietal peritoneal cavity, which protects the stomach and the organs. The blanket that goes over the stomach would be the greater omentum, and then this would be the mesentery right here. And then located downwards we have the bladder. And then the kidneys, you don't see the kidneys pulling them out, but we will go over the kidneys later. And I have a female cat, because you can see the fallopian tubes, but we'll go over that in the reproductive system. And that concludes my tour of the reproductive system. If I forgot anything, I'm sorry, but I hope you enjoyed. Thank you.